Then welcome everybody to the January 7th meeting of the Healthcare Workforce Committee. And a happy new year to all. At it again. 2026 looks like it's going to be an interesting, exciting year. A lot of new projects, or should I say, continuing projects, especially the healthcare needs assessment, which we'll get a chance to talk about a bit more at the end of this meeting. And so moving forward, let's see. I'm Ian Strauss. I use he, him pronouns. I'm the chair of the Healthcare Workforce Committee and am let's see. Let's go to the next slide, please. Okay, there we are. A little bit of housekeeping for today's meeting. This meeting is open to the public and does welcome public testimony. The meeting will be recorded. Live transcription is available. And if you're a committee member, please turn your camera on if you're able so that we can see you here in the meeting. Next slide. Okay, roll call. So let me, okay. So I'll call out names. No, we're at roll call. I'm just picking up it's there we are. Okay. Staff, please give us a quick, your name, organization you're associated with, and I think we're going to do a little more detailed introductions later on in the meeting, so we'll go there. Elena Shablowski.
Good morning. My name's Elena Shablowski. I'm a general dentist and I use she and her pronouns. I practice at La Clinica, which is a federally qualified health center in Southern Oregon.
Okay, welcome. Alicia Jackson. Amberina Fairless.
Good morning. Amberina Fairley, she, her pronouns, general dentist from Bend, Oregon, practice owner, president of the Oregon Dental Association. Excited to be here.
Okay, welcome. Andrea Brown.
Good morning, Andrea Brown. I use she, her pronouns. I am the traditional health worker liaison for Umpqua Health Alliance CCO in Douglas County, and I am a certified community health worker and peer support specialist. Thank you.
All right, welcome. Chancella Koulibaly.
Chancella did inform me she's unable to make it this morning.
Okay, thank you. Koi Vu.
Hi, good morning. I'm Koi Vu, pronouns she, her, hers. I'm the executive director of the Coalition of Community Health Clinics. Good to see everyone. I also am only able to stay for part of the meeting, so I'll be jumping out a little bit later today. Sorry.
Okay, well, thank you for coming. You have a great welcome. Eric Weiser.
Eric Weiser, he, him. I am a family physician by training at OHSU, where I'm also the assistant dean of rural UME, and I direct the Oregon AHEC.
Welcome. Gretchen Horton Dunbar. Kelly McKnight.
Good morning, Kelly McKnight, retired CEO from Options Counseling and Family Services. I use she, her pronouns, and it's great to be here this morning.
Welcome. Krista Lovas.
Good morning, Krista Lovas, she, her pronouns, Senior Director of Provider and Community Relations with WVP Health Authority, Independent Provider Association.
Okay, welcome. Laura Chan.
Laura also let me know she wouldn't be able to join this morning.
Okay, thanks, TT. Levi Anderson. Megan Holland.
Hi, Megan Holland. She, her pronouns. I am a family doctor in Coquille, Oregon on the South Coast. I am the chief medical officer there, do clinical care, and I'm also the regional associate dean for the Campus for Rural Health on the South Coast through OHSU.
Welcome. Molly Reynolds.
Good morning, everyone. I'm Molly Reynolds. I use she, her pronouns. I'm a program manager with the Care Pathways program with RISE Partnership, and we support in-home care providers throughout the state of Oregon. Thank you.
All right, welcome. Patty Barfield.
Good morning, Patty Barfield, she, her pronouns, OHSU nurse.
Okay, welcome. Rebecca Descombs. I apologize for butchering people's names. Please correct me.
Yeah. Good morning. My name's Rebecca Dacombe. It's the S's are silent in my last name. Thank you for asking. I am a travel health policy consultant. It's really good to be here.
All right, welcome. Regina Castellon.
Greetings. Regina Castellon, she, her pronouns, Director of DEI at All Care Health.
Welcome.
Thank you.
Bob Ross.
Hi, Rob Ross. I'm a family physician, retired from St. Charles, but still am involved with education in the Madras Family Residency Program, so with St. Charles and OHSU.
Well, welcome. Dr. Rosemary Hemmings.
Hello, good morning, everyone. Welcome to 2026. I own a group mental health practice in Beaverton, and full disclosure, I am on the Oregon Health Policy Board.
Welcome. Sophia Aiello.
Hi, everybody. I'm Sophia Aiello. It's Italian. I work over at EOCCO in quality measures. I'm really happy to be here.
Okay, Stephanie Grayson.
Good morning. I'm Stephanie Grayson. I'm the Chief Human Resources Officer at Adapt Integrated Healthcare in Roseburg. My pronouns are she, her, hers.
Welcome. Surya Carla Papi. Tessa Christensen.
I just admitted Tessa.
Okay. Tessa, we're doing roll call. So just give us your name and where your organization is.
You may want to repeat that. I think she just got in.
Okay. Tessa, we're doing roll call. So if you want to give us your name and where your organization is.
Good morning. I am Tessa Christensen. I work for Best Care Treatment Services. We are located in and around Central Oregon. And what was the other part?
That's good. That's good.
All right.
Welcome.
Okay, great. Thanks.
All right. And Virginia Chambers.
First of all, I love how we do this in alphabetical order, so I know I'm going to go last each time. My name is Virginia. I go by Vern. I use she, her pronouns. I'm the Director of Health Sciences at Clackamas Community College, oversees 7 different allied health programs here.
Okay, well, welcome. Welcome, everyone. Next slide. All right. I'd like to welcome the committee and all of our guests and also the OHA staff For OHA staff, please type your name and where you work in the organization. These are folks who do an amazing amount of work for the committee and for the state of Oregon, and we want to recognize them. So keep an eye on that. Let's go to the next slide. There's a list that's not exhaustive, I don't believe. I think there are more folks. So next slide. Okay, today's meeting should be an interesting one. We're going to look at our November meeting summary, get an update on, get some public comment, look at the OHPD and OHA updates, spend some time talking about who's going to be chair and vice chair for the next year for the committee, and then move on into an introduction to one of our major deliverables, the healthcare workforce needs assessment, and the contractor who will be working with us on that. Whoops, I missed committee member introductions. So that will also be in this meeting. So that being said, we've got quite a bit to go through. I'm going to move forward. Okay, the health equity definition and framework. Next slide. Okay, so all of the work that we do here in the Healthcare Workforce Committee sits inside of the conversation for improving health equity here in the state of Oregon. And so we like to read this health equity definition at the beginning of each meeting to sort of set that intention. So this time around, I'll read it and we'll get other people to read it at other meetings moving forward. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. Next slide. Okay. Because we've got a fairly busy meeting today, I do want to go through, normally we'll just look at these questions and move forward. I'd like to actually read them today pretty quickly. These are just things to think about during the meeting and how we can allow them to, to inform us in improving health equity. So, how do Oregon's healthcare workforce development efforts advance opportunities for communities experiencing health inequities? So question one we look at is, who are the racial, ethnic communities and communities that are experiencing health inequities? What is the potential impact of the resource allocation to these communities? Next question is, do OHA programs ignore or worsen existing health inequities or produce unintended consequences? What is the impact of intentionally recognizing the health inequity and making investments to improve it? How have we intentionally involved community representatives affected by the resource allocation? How do we validate our assessment in questions 1 and 2? How do we align and leverage public and private resources to maximize impact? Question 4, how should we modify or enhance strategies to ensure recipient and community needs are met? Question 5, How are we collecting REAL-D and SOGI as race, ethnicity, language, and disability, along with sexual orientation and gender identity data in OHA awards and matching recipient demographics with communities served? How are we resourcing and or influencing system partners to ensure programs optimize equity? So again, things to think about when you're doing the work of the Healthcare Workforce Committee. Next slide. Okay. Now we're going to review, actually, this is our November meeting minutes, not September. And I believe the November meeting minutes were sent out already. This is our voting issue for the day, or one of them. Excuse me. So I can't really speak to the November meeting. I wasn't actually there, but given that was sent out, it looks like we're looking for a motion to approve or any changes that need to be added.
I'll move to approve them. It's Rob.
Okay, we have a move to approve. Can we get a second?
I would second.
Okay. That was Megan, right? Yeah. Okay. And now back to our favorite list. Feel free to abstain if you weren't at the meeting. That's an option, yes, no, or abstain. Helena Shablovsky.
Sorry, couldn't find my mute button. Pass. Yes.
Alicia Jackson. Yeah. Amberina Fairley.
Hey, I'm sorry. As I said, I'm a dentist. I stepped out and did an exam real quick, so you're going to have to refresh me on the prompt.
Okay, just asking whether you've reviewed the minutes. You can, since you weren't a member of the committee, you can abstain if you wish.
I was not a member, so I can abstain.
Okay, Andrea Brown.
I abstain.
Okay, Sean Selleck, she's not voting. Koi Vu.
I vote yes.
Okay, Eric Weiser.
Yes to approve.
And Gretchen Horton Dunbar. Okay, and it's Ian Strauss, myself, and I was, as I said, not there, and I abstain. Kelly McKnight.
Approve.
Okay, Krista Lovas.
Abstain.
Levi Anderson. Megan Holland.
Yes.
Molly Reynolds.
Yes.
Patty Barfield.
Abstain.
Rebecca DeCombs.
Abstain.
Regina Castellon.
Abstain.
Rob Ross.
Approve.
Dr. Hemmings.
That was last year. I can't remember if I was there or not. Feels like it's been a long time, so I'm gonna abstain.
Okay, I hear you. Sophia Yellow.
Abstain.
Stephanie Grayson.
Abstain. I wasn't present.
Surya Carla Papi. Tessa Christensen.
I approve.
And Vern Chambers.
Abstain.
Okay. So that looks like it's approved. Next slide. Okay, public comment. Let me see. Do we have any public comment?
I have not received any requests. How about you, Jordan?
No, I have also not received any requests for public comment today.
Okay, so anyone in the meeting can give public comment. Is there anyone who would like to give public comment today? Okay, that being said, and hearing no response, we'll move on. OHPD and OHA updates. On to you, Deepti, and I believe Neelam.
Great. I had sent out an email, I think earlier, I don't know, earlier this week, last week, about Melina Moran. She was our liaison from the Oregon Health Policy Board to the Healthcare Workforce Committee. Unfortunately, due to a new job opportunity, she's stepped down from the Oregon Health Policy Board, and as of I think the end of last year. And so right now we are without a liaison from the Oregon Health Policy Board. So we'll keep you updated on that and the search for a new liaison. But in the meantime, I was just going to give some quick updates from the Oregon Health Policy Board meeting that happened just yesterday, actually. So from that meeting, OHA Director Hathi provided some updates about the federal landscape and the OHA response. She focused on the expiration of the enhanced premium tax credits through the ACA that went into effect at the beginning of the year. She also highlighted that for the first time, over-the-counter birth control will be available for Oregon Health Policy members without a prescription. It used to be only available with a prescription, and now it's available without. Another update that she provided was about the recent court ruling that did not go in Oregon's favor, which was that CMS may now share limited information about Medicaid enrollees that are undocumented with other agencies. So she provided a little bit of information about that, and OHA is going to be figuring out sort of their response to that and what they can do going forward. She also talked about the very recent CDC change to the childhood vaccination schedule that slashed the number of recommended vaccinations for children from 17 to 11. She stated that all the vaccinations are still covered, but the change is expected to increase confusion around this area. She also added that the West Coast Health Alliance, which Oregon is a part of, they made a decision to continue endorsing the AAP recommended vaccination schedule. The next update was from the Rural Health Transformation Program with some really positive news that Oregon was awarded $197.3 million as an award for 2026 from CMS. This is really a huge award based on Oregon's size, and OHA is really pleased with the outcome. They also mentioned that the funds for subsequent years are not guaranteed, but if approved for similar amounts in subsequent years, Oregon would receive an estimated $1 billion over the 5-year grant period. They focused about an hour of the meeting on the Oregon Health Transformation Program. And so if you want more information about that, I really encourage you to follow that meeting. I'll put the link to that recording and to the slides in the chat. And so some other things about that Rural Health Transformation Program. Right now, we are in phase 1. It started at the first of the year, and they're going to be focused on 3 pathways for fund distribution. something that they're calling Catalyst Awards, which is a grant process that's for ready to go projects that can be implemented in this year or in 2027. There's also something called Immediate Impact,
Read here.
which is direct awards for select set of aligned opportunities that are identified by the state, so not a grants process. And then the third set of awards are called Regional Sustainability, and there's going to be a subcontractor that's going to facilitate and provide TAs to entities to develop rural health networks and provide regional solutions. After this, they'll be focused on phase 2, which will take us through 2028, 2029, and 2030. And that phase will focus on incentivizing true transformation with increased expectations related to regional alignment and sustainability. They also talked about that because the money is expected to land and be going out the door pretty quickly, their key guiding principles for this launch are to focus on self-identified healthcare needs in rural communities, to quickly and effectively distribute these funds, to ensure that projects are aligned with outcome metrics to strengthen CMS likelihood of future funding for the state, and to really focus on a strength in partnerships. So yeah, if you'd like more information, I highly suggest you watch that recording. The other very brief update was that the Health Policy Board now has 2 additional committees that are being launched to address their 2 priority areas, which were affordability. So there is a new affordability committee. And then there is also a even newer committee, which is based on primary care, which is actually actively looking for, is recruiting for members, and will start meeting in April. And I'll drop the links to both of those committees in the chat as well. That was it for the Oregon Health Policy Board updates. Thank you. We can move on to the OHA written updates, which were put in the chat and were also in your meeting materials packet. So you can review those written updates. We also have Melissa from the How To Grant program that's going to be giving a verbal update about that program.
Good morning, everybody. This is Melissa Yates. I use she, her pronouns. We just wanted to highlight that we included a meeting summary for the all grantee meeting. Excuse me. So that meeting happened back in September. It's an opportunity for all the grantees to get together within the How To Grant program, share successes, challenges that they're facing. And so we just wanted to highlight that update that's included in your meeting materials.
Okay. Well, thank you, Melissa. That's great. Okay, DP, any more updates from the OHA side of the house?
I don't think so. How about you, Neelam? Any additional updates?
No, I don't have anything in addition. Thank you.
Okay, well, thank you. Next slide. Now for the eagerly awaited, at least by some of us, election of chair and vice chair. So I guess our first question here, well, let's do this. So the chair of the Healthcare Workforce Committee and the vice chair as well are folks who make sure that the sort of logistics of the meetings and the work that we're doing get completed, that provide a liaison function between us and the OHA staff to be able to answer questions and give feedback. We meet monthly with the OHA staff to discuss topics in future meetings and make sure that we have somebody to do what I'm doing today and lead the meeting. Keep an eye on where things are going and what the committee thinks is important. There's a phenomenal amount of possibility in what we can do in these meetings. And so having some voice into directing that puts the position in a lot of, gives the position some real function there. The vice chair supports the group when the chair is not available. So having somebody else with that information and that knowledge as we move forward, all of this will be moving forward. There's a lot coming up with the needs assessment and the healthcare provider incentive program evaluation over the next year. So really looking at how we're going to do this better and how we're going to have a voice as a committee in the work that we're doing. Sometimes a lot of work will happen behind the scenes and we're not as knowledgeable about as a committee as a whole. So the chair and the vice chair become the voice in that area. So I'd like to open the floor to people who are interested in running for chair or vice chair. Please note you can nominate yourself.
Just a quick question, Anne, has this this question been asked and answered previously? In other words, do you have candidates who have already volunteered?
No, we do not. We've asked this question a number of times. Nobody has stood forward for the positions.
And so you're very eager to have the positions filled. I considered nominating or volunteering for one of those roles. So I may not know enough about it, but we'll say that out loud here in front of this group.
Okay, well, thank you, Kelly. I'll tell you, many of us who stepped into that role, being me, really had no idea what was involved. We stepped into it. Okay.
I'm not sure that that's comforting.
Well, I think we've done okay.
Yes, you have.
Just to let you know, I will be available as the outgoing chair for the next year. That's part of our process, is having the previous chair available and at these meetings to be able to provide input feedback. So you're not going to be left alone. And the OHA staff are really great when it comes to that.
Well, I'm seeing in the chat a request to have page 17 from the charter dropped into the chat, or the link to the charter maybe dropped in the chat so we can take a look at that.
Okay. I see a head shake, I think. Okay. It's the Affordability Committee charter. Is that us?
Sorry, that was an error on my part. I was looking at that earlier. I will drop the correct charter into the chat.
Great, thank you. Okay.
Ian, can I just add on, to Kelly's question about the length of service? Usually, it hasn't always happened. The vice chair then the following year will be the chair, and then the following year will serve as the immediate past chair. It hasn't always happened that way. We've had chairs sometimes volunteer to be chair for more than 1 year in a row, and vice chairs also, but that's the kind of what is the goal.
Okay. So we have Kelly, who has volunteered for one or the other position, I understand. Um, any other members who are interested in chair or vice chair? And the nice thing about vice chair is that you get a year to learn what all is involved, so that when you make that choice, you can move forward. You can be vice chair for more than 1 year, I believe. There is nothing in our bylaws or our charter that says not an option.
I might volunteer for vice chair if no one else does.
Okay.
If we're having trouble finding someone.
Hey, okay. Sounds good. All right. Anyone else?
I would love to volunteer as well
For
for a vice chair position.
Okay, Jessica.
Just to clarify, anyone that's a current member of the Healthcare Workforce Committee can step up to be chair or vice chair, but it is limited to only those who are current members of the Healthcare Workforce Committee.
Yeah, so I was looking at my list going, sorry, Jessica, we appreciate your interest.
Yeah, sorry. I thought it was open to public, but thank you for clarification.
Yeah, no worries, no worries. Okay, any other committee members interested in these positions?
Do you have an auctioneer's gavel, Ian?
Going. Actually, what I have is a roll call yet again. Oh, because we love reading everybody's names over and over. So here we are. So Kelly, would you be, since we have you as an open member, would you be interested in being chair for next year?
Yes, I believe I can make that commitment.
Great. Okay. So we need let's see. Boy, losing the conversation here.
Hi, I have a question.
Yes.
Who is the current vice chair?
There is no one currently in that position.
Oh, okay. Got it. All right.
Jordan, would you mind advancing to the next slide, please? That has, I think, the positions where
I was in an earlier slide, I believe.
Do you need a motion for Kelly McKnight?
Yeah, we need
to
a
be
motion
chair? I
Pardon?
would so move. I would make a motion for Kelly McKnight to be chair.
Okay, so Megan, and do we have a second?
Second.
Patty to second. And so I will go through the list. Elena,
I vote yes.
Alicia,
Yes.
Amberina,
Yes.
Andrea,
Approve.
Coy,
Yes.
Eric,
Approve.
Gretchen, Ian, yes. Kelly, I guess you get to vote for yourself.
Sure. Okay.
Krista.
Yes.
Okay, Levi. Megan.
Yes.
Molly. I believe she stepped out. Patty.
Yes.
Rebecca.
Yes.
Regina.
Yes.
Rob.
Yes.
Dr. Hemmings.
Yes.
Sophia.
Yes.
Stephanie.
Yes.
Surya. Tessa.
Yes.
And Vern.
Yes.
Okay, so congratulations to Kelly as the new chair. Now we will go through again for vice chair.
Hi. I know there's probably going to be a motion on the table. So it sounds as if there are several people who express interest in being the vice chair. Is that correct?
I only have one for this year.
Oh, okay.
Uh,
I thought I heard several people say they were interested, but maybe I heard wrong.
did I miss something?
No, there was a second person who expressed interest, but she's not a current member of the Healthcare Workforce Committee, and that's a requirement.
Yeah, that's what I thought. Okay.
Okay.
So motion for Tessa for the vice chair. We have a motion?
I will move that Tessa become the vice chair.
Okay.
Second that.
Didn't catch who seconded it.
It's Megan.
Megan. Okay, great. So we have a motion and a second. Elena.
Yes.
Alicia.
Approve.
And Marina.
Yes.
Andrea.
Approve.
Coy.
Yes.
Eric.
Approved. Sorry.
Okay. Gretchen. Ian. Yes. Kelly.
Yes.
Krista. Krista.
Yes.
Okay, great. Levi. Not here today. Megan.
Yes.
Molly. Also not here anymore. Patty.
Yes.
Rebecca.
Yes. Sorry.
Regina.
Yes.
Rob.
Yes.
Dr. Hemmings.
Yes.
Sophia.
Yes.
Stephanie.
Yes.
Surya, not here. Tessa, you get to vote for yourself. Not.
Sure.
Okay, there we are. And Vern.
Yes.
Okay. Wow. Faster than I thought we would be able to do that. Excellent. Good job, everybody. So our chair and vice chair for next year will be Kelly McKnight for chair and Tessa Christensen for vice chair. And I will step into the role of immediate past chair. Deepti or Neelam, do we need to have this approved by the OHPB or is this just a notification?
I think we're all set.
Okay, so congratulations.
Yeah.
Okay.
Can I ask a fundamental question? Because I'm kind of interested in why the term of 1 year was chosen. Because I don't know, if being a chair for multiple committees in the past, a somewhat longer tenure might add to the stability, but I don't know the history.
Uh, I was on the committee that created the charter, and I'm not sure that was in the discussion. I think we just went with what was there before. Might be something to talk about in the future if we go back there.
Yeah, maybe we should, because I think you might get more people committed if there's a longer tenure, and they might think that they can have a greater period of influence, or whatever, influence or involvement.
Yeah. Yeah, I don't.
I mean, not that I'm forcing you to volunteer for another 6 years as being chair, but
Oh, okay. Yeah, no, I think I declined that one. It's actually a fun position to hold in terms of having a group of people who are really engaged and really interested in what's going on. It gives you a lot of opportunity for these conversations. Okay, let me see here. So I'm going to move us down then. That completed. I will say we do not have a break in this meeting segment since we cut the meeting short. So feel free to stretch and whatnot so that we can, go through.
Ian, I just wanted to point out, I just pasted it in the chat from our charter. So the chair and vice chair can be elected for more than one term, so that they can actually serve for one term, or 2 years, or two
yeah,
terms. So no more than that. But I agree, we could definitely talk about changing the term.
yeah, I saw that. I just interesting. Okay, thanks.
Yeah. For those who don't know, the terms are, I believe, 3 years and with a second term available. So you can
Yeah.
be in and then you have to go. That's our current charter, how that goes. Okay. Well, I think we're going to go through and what we're looking at. Next slide. Okay. So we can call off the roster and go through and tell us for each committee member your name, your personal pronouns, the organization and title you hold, and then give us a reason why you're passionate about the healthcare workforce policies and programs. Give us a little more insight into who you are. And just for fun, I'm going to start at the bottom of the list this time. Sorry, Vern. There you go.
I was getting comfortable. So my name's Virginia. I use she, her pronouns, and I go by Vern. It's easier to yell, and if you're trying to get a hold of me. My organization, I'm from Clackamas Community College. I'm the Director of Health Sciences, so I provide leadership and support and accreditation compliance for 7 allied health programs, including nursing. I have been in the healthcare field since I was 18, not to date myself, but it's been a long time. And I've done everything from creating curriculum from the patient-centered medical home model through OHA for medical assisting and ambulatory care to teaching students about data metrics and outcomes, talking about federally qualified health centers. I love training. I love education. I love curriculum. I am trying to align and bridge some of the workforce needs when it comes to CTE and just training needs to our academic higher education, post-secondary school needs. And it all has to do with equity work across the board. So this is a really amazing group. I've been following and applied a few years ago. And the fact that I actually am on it now, I'm super excited. And I'm feel very lucky to be in the room with all of you and all your expertise.
Okay, well, thank you. And Tessa, you're up next.
It looks like Tessa in the chat's taking a call right now.
Oh, okay. Here we are. And Shreya's not here today. Stephanie.
Sorry, I had to find the unmute button. Um, Stephanie Grayson, the Chief Human Resources Officer at Adapt Integrated Healthcare. She, her pronouns. I think what has really interested me about this committee and being on here is all about workforce in my role, all about training and development in my role, and in healthcare in general. There are a lot of challenges in the workforce, particularly in development and recruiting and retention of quality employees. And so anything that I can bring to this group and anything that I can glean from this group to take back to our organization is certainly something I'd like to do. Gleaning things from the group would be very beneficial for us, but ultimately, I think the things that we can do here can impact all of the healthcare workforce in Oregon, and I like being a part of that and being able to contribute to that.
Okay, thank you. Sophia.
Hi, everybody. I'm Sophia. I go by she, her pronouns. And like I was saying a little earlier, I work for the Eastern Oregon Coordinated Care Organization in quality metrics. So what interested me in this role. So in my role right now, I work directly with providers, and I've kind of seen like through working with them firsthand how, turnover and workforce shortages can really drastically impact quality of care, including like reaching those quality measures, which, as you might know, can really fund a clinic and help them stay open. So yeah, just kind of going through that with providers and helping them, I came across this committee and it really interested me, kind of like what Stephanie was saying, like just to learn about what we can do or like what, impact I can have with my clinics and to kind of take back to them being a part of this community or this committee. So I'm excited to be here.
All right, thank you. All right, Dr. Hemmings.
Yes, Rosemary Hemmings. I go by Dr. Hemmings. I use she, her pronouns. I own a group practice in Beaverton. And my reasons for being on this committee, I'm passionate about creating equity in terms of access to healthcare providers who reflect the demographics of the people who are trying to access healthcare, which includes behavioral health, oral health. And when I joined this committee, it was actually before I was on the Oregon Health Policy Board. And it really came out of hearing and seeing Oregonians who were having difficulties, finding providers that they felt that they could relate to, and also recognizing the barriers that exist for those who were interested in entering the healthcare workforce, accessing, educational opportunities. I spent several years at OHSU in the School of Dentistry, and just recognized just how much inequities existed in terms of pipeline programs for students of color. OHSU certainly has done a lot of work in that area, but I think just, as a country, We still have a lot of work to do as it relates to working with young children and exposing them to all the different areas of in the healthcare field, and not just exposure, but also creating opportunities for them. The tide is shifting. I think we're going backwards right now. And I think this committee definitely is going to have a role to play within the state of Oregon as we look at the impact of what some of these federal and national changes will have on the healthcare workforce moving forward. So that's kind of where my head is right now. Thank you.
All right, thank you. All right, Rob.
So, I just retired from a 40-year career in healthcare, 30 of which was working for academic institutions and taking very seriously the education part of my career, which I think is incredibly important for all professions. Doctor from the Latin root is teacher. And so I think as professionals, nurses, doctors, psychologists, all of us are responsible for making sure in our professional abilities that we're training the next generation. So, having been part of starting 3 different family medicine residencies and working for 20 years in an extremely underserved community and county in Klamath Falls just has made me more passionate about trying to improve access. And yes, I've got to agree with Dr. Hemmings on things are going backwards, not only for equity and diversity, but for access. And it's very hard in a system that is based on the false premise that medicine and healthcare should be a profitable business designed pursuit, which is just fundamentally flawed in its own. We've all got to take responsibility and do the best we can to make sure that us and future generations have access to healthcare. And so this seemed like a logical committee to join and remain on, and hopefully we can get some really tangible results out of it. Because I'm a type of person that hates not getting things done. And, I've watched this state not do a lot of things to improve the condition of access, and hopefully we can, turn the tide. So I think that's the important thing.
All right, well, thanks, Rob. Regina.
Greetings, everybody. From Talent, Oregon. She, her pronouns. My title at All Care Health is Director of DEI. And why am I here? What excites me? It's a lot of things that many of you have said in regards to access. I experienced that myself. I would not be here today if it wasn't for a few teachers or a few people in my life that granted me the door and opened it very wide and supported me through. What's really has changed me a lot in regards to access to healthcare and healthcare workforce is I've been part of healthcare workforce in human resources for the past 10 years. And I really got to see the gaps that have been there since I started my career, and they're still there. And it's almost like 2 steps forward, 8 steps backwards, and then like maybe 1 step forward and then maybe 1 step backwards type of situation. But one thing that has inspired me a lot is working at Road Community College. I teach English there, and I get to see my students thrive, work full time, and wanting to go into pre-nursing or wanting to be a dental assistant. And so I get to really see up close what the barriers are. Last year, I was a tutor for a CNA program. Never been a CNA, but I know how to read and pass tests, and I know that that could be a privilege there. And it was so, it just reminded me that you cannot be what you cannot see. So part of access is to inspire and to just give that visual of the younger generation of what they can do. And that's got to always be the case. And also what I've learned is that when you open the door and you give access, we're not done. We're not done yet. We want to make sure that those that we gave access to finish the cycle. And that really creates sustainability. And that's what holds me. And that's why I'm here. Thanks. Thanks for having me.
Thank you. Rebecca.
Hello, good morning. Good morning. My name is Rebecca Descombe. I am Inupiaq, originally from Utqiagvik, Alaska. It's the farthest north you can go in the United States. I have lived here in Oregon now going on 17 years, so Oregon is my home state. I am a tribal health policy consultant working with tribes and urban Indian organizations to help advance, equity health policy within the Indian Health Service, Health and Human Services, and related governing boards and committees. My work centers on advocacy and community engagement, policy research, testimony development, and strategic communications, including newsletters and media outreach. I support tribal participation in the legislative and regulatory rule changes, support delegates who serve on Indian Health Service, tribal advisory committees, and other consultation advisory processes, just really helping ensure tribal voices are meaningfully represented in health policy decision making. In writing testimony for IHS consultations, healthcare workforce in tribal communities is at the forefront of discussion with chronic underfunding and understaffing of tribal health clinics across the country. And this is one of the biggest reasons why I wanted to serve on this committee. One last note about myself is in January 2025, I became a certified and registered community health worker in the state of Oregon, with training provided by the Future Generations Collaborative Native Wellness Institute, with a focus on working with the Native American Alaska Native communities in Oregon. So I'm really excited to start my journey working with the OHA Healthcare Workforce Committee and all of you.
All right. Well, welcome. All right, Patty.
Hi, thank you. Patty Barfield, she, her pronouns. I work for Oregon Health Science University as an associate dean for the School of Nursing on the LaGrande campus. We're based on Eastern Oregon University, or hosted by EOU, and for the campus of Rural Health, which gives the interprofessional students. I've been a nurse for 45 years. 20 of those are as a psychiatric mental health nurse practitioner. And so I'm in the give back, pay it forward, lift up the next generation of healthcare providers and nurses. I do workforce development in the nursing sphere with HRSA grants for primary care and currently a Rural Nurse Scholars Grant. I feel determined to stay in this work until rural communities have better access, more equity, and the population is thriving. So they're going to have to shove me out of my office is how I feel about it.
You're going to have to live to 200 years old.
Well, you know what? I am committed. Thank you.
Okay. I believe Molly has left for another meeting. Megan.
Hi, Megan Holland. I am a family physician in Coquille, Oregon at Coquille Valley Hospital. I'm the chief medical officer of that organization, which has been growing a lot in the last 6 years. And then I work for OHSU also as regional associate dean for the Campus for Rural Health. I actually grew up in poverty in rural Arkansas, and I went to school as a non-traditional student with 2 little kids, not a lot of support. And And at that time, there really weren't any pathway programs, not a lot of guidance or encouragement along the way, mentoring. I feel like we can do better, and we're starting to do better, but I think that there's still work to be done. Not only for younger students as they're going through middle school and high school, but also people that are returning to the workforce or trying to get into better careers. And I feel like this is the right committee to help with that. And then, on a personal note, I've been in rural practice now for over 20 years, and I'm aging in a rural area. And I think there's national concerns about how can we help our aging population in rural areas age with dignity and grace with the services that they need, and how do we get those services to them. So thanks for having me on the committee.
Hey, thank you for joining us. Okay, looks like Levi and Laura are not here today. Krista, you're up.
Hi there. Krista Lovis, she, her pronouns, Senior Director of Provider and Community Relations with WVP Health Authority. We're the Independent Provider Association serving over 450 independent practices or providers in 93 practices in Marion and Polk County. One of the reasons I was interested in joining this is I've been in this role for almost 20 years, and watching the potential changes coming up, seeing the challenges that are being encountered.
I bought two of these before, but I bought one at higher
is a
prices.
huge
So can I
concern.
return?
Somebody got there an open mic. Okay.
I think you got it. That's okay. I was
You guys
almost
used to be able to do it.
but just really looking forward to bringing the needs of the providers here, looking for recruitment, resilience, retention opportunities. I see the potential cliff that we're coming up against, really around primary cares, as well as the specialty providers that I'm really seeing reduce in the community. So looking for ways to ensure that our community people, myself, still have physicians that we can go see, that can treat us, that can treat our community. So that's why I'm here.
All right. Thanks for joining us. Kelly.
So this is not a campaign speech. Just want to start with that. I have taught at Chepacabana Community College for a number of years, so have that education background as a number of you as well. And I worked for Options Counseling Services for 31 years, doing mental health and family preservation services through child welfare. And I think what has grabbed my attention with this committee is access gaps. When I think about it, it isn't easy for me to get specialty care as a person with private health insurance or even primary care. And our clients, many of them are Oregon Health Plan members, and their struggles are serious and can often lead to worsening health conditions because they can't get into mental health care or they can't get into primary care or dental care. I've also done some legislative advocacy, and I've really enjoyed being at the Capitol here in Salem, talking to lawmakers about what clients and providers need. So look forward to continuing to work with this group for the next 12 months. And thank you for this opportunity.
All right. Thank you. And then I guess it's me. My name's Ian Strauss. I use he, him, and L pronouns. I recently retired from a 45-year career in healthcare and technology. So an interesting little mix. Started out as a crisis intervention supervisor, moved through a number of other different roles. Recently, over the last 20 years, I've run a primary care clinic out of a federally qualified health center, Whitebird Clinic in Eugene, and then moved on to work with the groups like reviewing grants for HRSA and that piece, that kind of thing. So really my commitment in all of this has been to make healthcare available and understandable. Yeah, there's a great one. For all the members of my community. My clinic's primary population was homeless and low income, and it was amazing to see the barriers that people would have to work through just to be able to have a conversation about their own health. So really have enjoyed both, the work in healthcare, but also the work in being able to bring those conversations about overcoming boundaries and barriers into the work that we do in administration and in making things simpler and easier as we move forward. So that's me. I believe Gretchen is not with us today. Eric, you're up.
Thanks. Not to be too long-winded. So I came to Oregon 19 years ago, and with my wife, who's also a family physician, we started practicing at the Sublimity Medical Clinic at San Am Hospital, and had a pretty wide scope practice. Primary care, went to the nursing home that was behind us. We covered the ER, did shifts in the ER, hospitalist work, delivered babies, did C-sections, did neonatal resuscitation. So really kind of everything. And after about 6 years of that, we really wanted to, and we had students all along the way. We had PA students from Pacific University. We wanted to teach more, and so came up to OHSU and started an academic career. Got involved in residency education, student education. Also become involved in the Oregon Academy of Family Physicians and gotten to know more people across the state. And with that network, as well as rural experience, ended up being the AHEC director in 2020, right before the pandemic. And AHEC is, it's funded by HRSA. That's part of our funds, and the other part of the funds go by the state through HSU. And our three main objectives is really to have a more equitable distribution of the healthcare workforce, including rural and urban underserved. Having one that's as diverse as the community that it serves, and even though depending on what administration it is whether they talk about the diversity piece or not. And the last thing is just enabling for practice transformation to transform one's practice around the needs of the community. So why this committee? I think there's a couple reasons. One is that more than half of my dollars come from the state through the governor's budget, and I think it's important to be involved and be accountable to the funds that I'm supposed to be doing about workforce development and particularly primary care and also the distribution thereof. But through the work too, just become passionate about like what the workforce is composed of and where it's located is a public health problem, like it is. Like it affects our longevity and our health. Anybody who practices in a small town would recognize that. A provider retires, and next thing you know, like people don't have primary care. But on a big system, thinking about how we train people, where we train people, recognizing that once they're admitted and trained, it's really hard to influence. Once that admission committee determines who's there, the diversity is set. Like you can't create diversity from, you can't change the deck of cards. It's set when you open it up, So that piece of passion there too. The other one is that there's not a whole lot of engineering in our system. Every healthcare system is its own entity, and it's certainly with profit margins and the driving and the drive to stay open is very strong. And so there's little coordination and engineering across the whole system. And so I'm really happy to be here and to work on the system as a whole, recognizing how we do it, where we do it, why we're doing what we're doing affects our lifespan and our and equity. Thanks.
Oh, Ian, you're muted.
Well, that's not helpful. Okay. Just to let everybody know, we've got 10 more minutes on this item, so it's about 2 minutes a person. So just whatever we can do there.
So, Ian, you're off mute, but your mic's not working.
It, it, it,
Testing? Are we back?
your mic's still not very good.
While Ian is figuring that out, I think we can move forward with the introductions. I think we were on Koi Fu. She might have had to step away. Chancella was unable to join us. Andrea, can you introduce yourself, please?
Good morning. I'm Andrea Brown. I serve currently as the traditional health worker liaison for Umpqua Health Alliance CCO in Douglas County. I am also a CHW and which community health worker and peer support specialist, and I was involved. I became a PSS and a CHW before there was a certification process in Oregon. So I was involved in the early days of that certification process coming to be. And I've been doing this work a long time, couple decades. So as you can imagine, I bring a lot of identities with me as a traditional health worker. I was born and raised in Oregon, grew up in a rural community. I work in a rural community now, even though I live in Eugene. I'm a former consumer of Medicaid services. I am a person with disabilities. I'm a domestic violence survivor. So when I think about healthcare workforce policy and programs, I think about the issues with access and equity that I've run into as a person with multiple identities, and then now doing primarily workforce development for the CCO with traditional health workers. And just kind of, my interest really is around what can we do to grow and retain our workforce in rural communities, our workforce that works with populations that experience those issues in access and equity. So I also think about it in terms of, educational access as an older, non-traditional student who's decided to go back and try to obtain my degree at 48 years old and what that, the challenges that has presented. Yeah, so that's kind of my reasons for being here. I'm really excited to be involved and the opportunity to collaborate. Thank you.
Okay. Can you hear me now? Hello?
Good. Yep, loud and clear.
Okay, great. Okay, well, thank you, Andrea. Amberina.
Good. Oh, I can still say good morning. We still got a couple minutes. My name is Amberina Fairley. Pronouns are she, her. I am a general dentist who just bought a private practice last week in Bend, Oregon. So brand new practice owner in the thick of it. It's what a good time to have a meeting. But I not only am a private practice dental owner, I am the current president of the Oregon Dental Association, and I sit on the American Dental Association's Workforce Ambassador Group, as well as the Oregon Board of Dentistry's Dental Assistant Workforce Shortage Advisory Committee. Really, workforce has kind of been my interest, for the last few years, primarily as we have seen post-pandemic drop-offs in hygienists and assistants that are available. Prior to buying this office, I was a Medicaid provider, and so I worked at an office that had a significant challenge hiring dental hygienists, and currently still does not have a dental hygienist, which just pushes off necessary care for, patients who need it most, patients in classifications that require maybe more care than others. So really, my entire intent in being here is just to learn as much as possible, to figure out some ways to try and increase, workforce members into the pipeline, how to keep them in the pipeline, how to encourage young people to join, how to encourage diversity. Really, I'm here for it all. I just want dentistry and medicine to prosper. Thanks.
Okay, well, thank you. Let's see. I believe that Alicia had to go to another meeting. So, Elena.
Cool. I think last but not least, so again, my name is Elena Shabloski. I am also a general dentist. Amber and I were classmates, so we were on the same timeline. And I practice at La Clinica, which is a federally qualified health center in Medford, Oregon. Close to Regina in talent, and Regina and I used to work together. So lots of fun connections on this committee. And I have been on the committee. This will be my 6th year. So coming up on my last year here. And what really prompted me to join the committee was my role helping to train dental assistants. So we don't have a formal didactic training program at La Clinica, but we support Rogue Community College in having multiple dental assistants rotate through our clinic and do their externship every year. And I run that sort of training program in-house. And so kind of got to see that up close and personal, and have seen how the demand or the interest in dental assisting has changed even over the last 5 years. I also come from a family of teachers. I'm married to a teacher. My best friend is a teacher. My mom is a teacher. And so like many of you have said, I'm really passionate about how we talk about healthcare professions early in school, and talk specifically about oral health and all of the other opportunities in the healthcare workforce. During the last 5 years, I've learned a ton. Learned so much more about other professions across the state. And so I feel like I know less now than I did when I joined the committee, and am just here to be a voice for oral health, to be a voice for a clinician that still sees 70% Medicaid patients 3 days of the week, and here to continue learning. So thanks.
All right. Well, thank you. I noticed that Gretchen has joined us, so well, you don't get to be last. Sorry. Okay, Gretchen, can you give us your tell
You
us
bet.
about.
Thanks, Ian, and apologies for being late. Welcome, new members. My name is Gretchen Horton Dunbar. I use she, her pronouns. I currently am a consultant with Mercer, but I came to the committee when I was employed by Pacific Source and oversaw all of our workforce development, including developing our traditional health worker, so peer support, community health worker, doula benefits for Medicaid. I have an MPH and a healthcare MBA. I am super passionate about not just pipeline development, but really innovating with our provider types, and supporting our communities and accessing culturally and linguistically specific care. And I'm thrilled to serve on this committee. We do a lot of great work thinking forward, and I'm looking forward to the contributions from our new folks. So welcome. Thank you.
All right. Well, thank you. All right. We have 2 student members who, let's see, Chancella Koulibaly, who's new, and then Laura Chan, who's been with us for a year. Neither one of them were able to make today's meeting, but just to keep an eye out for other faces on the committee. And that ends our introductions for this meeting. Our next step, let me see, Deepti, are we ready to move forward with the Center for Healthcare Workforce Studies?
Yeah, we are, and somehow we are exactly on time. I'm just going to give a really brief overview of the healthcare workforce reports, especially for the new members. Next slide, please. Also, I wanted to thank the new members for joining us today. Before this meeting, we had an hour and a half orientation with them. And so it's just been, I'm sure, a whirlwind and a lot of information that we threw at them today. So thank you for hanging in there. We are here today to introduce you to the contractor that's going to be working on our two big buckets of work, which is the healthcare workforce needs assessment and then also the evaluation of the effectiveness of the healthcare provider incentive programs in Oregon. Just a little background, we are required to deliver these two reports every other year to the Oregon legislature. So the next set of reports will be due in 2027. The two reports there you're very familiar with. It's the Healthcare Workforce Needs Assessment and then that evaluation of the incentive program. We will be contracting with the University of Washington Center for Health Workforce Studies and then the Rural Health Research Center. They're going to be supporting the committee in developing these reports. And we have them today here to provide an overview of both of their centers and also provide a little bit more information about how they'll be engaging the committee. With that, I turn it over to, I'm not sure who is starting first, but I'll turn it over to you folks. Thank you.
Janessa was starting, but is Janessa on here?
I'm here.
There you are. Now I can hear you. Yeah.
Next slide, please. Maybe the next one. There we go. Great. So it's wonderful to be here and to sort of meet everybody. We caught the tail end of the introductions as well. I am Janessa Graves. I'm the director of the WWAMI Rural Health Research Center and an associate professor in the Department of Family Medicine at the University of Washington. And I'm working with Paula Kett. We'll introduce both of us separately, both of the centers separately here. And we are just really excited about being able to contribute to this important work in Oregon. So we can go to the next slide. And I'll introduce myself and then I'll pass the torch to Paula, who will introduce herself and kind of talk about CHOOSE a little bit. So as I said, I'm the director of the WWAMI Rural Health Research Center, also called the RHRC. And the work that I do, I'm a health services researcher by training. The work that I do really focuses on rural health and rural health workforce, with a particular interest in rural behavioral health access and workforce. And so I've led a lot of numerous projects at the state and federal level, looking at workforce and rural health access to care, including work with the workers' compensation programs across the country, and then some federal work around Medicare reimbursement for different provider types and changes in Medicare reimbursement, and how that's changing the landscape of our providers across all geographies, although my specific focus is on rural communities and ensuring that we have adequate services. So Paula, I'll pass it to you, and then I think you'll talk about CHOOSE, and then we'll come back.
Great. So great to be here and nice to hear the tail end of some of the introductions. So my name's Paula Kett, and I'm Deputy Director of the Center for Health Workforce Studies, or CHOOSE, as we like to call it. And then I also am a research assistant professor in the Department of Family Medicine. My background is actually as a nurse. I worked in public health for a long time and then moved into research, and a lot of the kind of health workforce occupation areas that I tend to focus on are public health and perinatal health. Those have a lot of overlap and also kind of wide ranging. I support a range of projects here across the center that are both national and state based. And I'll just, if you want to go to the next slide, I'll start give you a little bit of an overview of our team. And then of the center, and Janessa, feel free to jump in here too. But we wanted to just kind of give you a sense of who else is going to be on the project. So we have a large team at Choose, and RHRC also has a team of research scientists, and we're using staff from both of our centers to support. And this is a group of staff that has a lot of familiarity with doing state-focused projects. We do a lot of projects in Washington State, focused on different occupations and rural and urban distribution of those occupations. And so that's our kind of research scientist group. We have program assistant and coordinator who help us with a range of kind of support type roles. And then at the bottom, Bianca Frogner, who's our director of Choose, Sue Skillman, and then Benjamin Stubbs are all providing additional support and kind of an advisory role on the project. So that's our team overall. Perfect. So just a little bit about Choose. So this is broadly the team in that we have a team of research scientists and some faculty, and then we work with a number of affiliate faculty, both in the Department of Family Medicine, but also across the school, depending on project and kind of what areas we're focusing on. So we tend to have everyone has kind of their different lenses that they bring. So since it was established, it's been housed in the Department of Family Medicine, and we conduct really policy and practice oriented research focused on the health workforce, right, to inform practice in those areas. And both national, like I said, and federal funding, and then state contracts. There's kind of four large buckets of things that we focus on with the health workforce, including looking at career pathway development, just describing, so supply, distribution, need, characteristics of the health workforce, demand, looking at effective recruitment and retention, and then looking at policies and programs to support a diverse workforce. You can go to the next slide here. So on a kind of more national focus, we house 2 of 9 health workforce research centers in the US. And so this is a list of the 9. We have one focused on allied health and one focused on health equity, which I'll describe a little more in a minute. And then other health workforce centers, you can see, look at a range of occupations. So there's an oral health, one looking at public health, behavioral health, et cetera. So you can go to the next slide here. So for the 2 centers that we have one focused on allied health. Bianca Frogner is the director of that, and then Ben Stubbs is the deputy director. And this was established in 2014, looking at different workforce groups over time, including pharmacy, rehab, clinical lab workforce, long-term care, those in low-wage jobs. And then in the Health Equity Center, we look at, we talked a little bit, I mentioned diversity in the workforce, but really looking at how can we support, what factors are supporting a workforce to be more representative of the community that they serve, but then also looking at things like competencies, skills, et cetera, that are needed in their roles to advance health equity or to address inequities in the spaces that they work. So this was established in 2018, and we've looked at, again, public health workforce, the nursing workforce, maternal and child health, such as doulas or nurse midwives, insurance navigators, workers with disabilities, immigrants, et cetera. And types of things we'll look at within those, again, are things like characterizing their roles. Sometimes it's just a newer occupation that the broader public or others might not fully understand. And sometimes it's looking more at career pathways or kind of where they're distributed, et cetera. So you can go on to the next slide. So then I just wanted to talk about a few state-focused studies. This is one some of you might be familiar with, but we have the Sentinel Network, which was established in 2016 and is an initiative done in collaboration between Choose and the Washington State Health Workforce Council. And really the focus of this is to provide regular data related to health workforce demand across the state. And this information is collected via a survey that's conducted once a year to health workforce employers throughout the state to provide ongoing and up-to-date information on needs and challenges related to the health workforce. So this is legislatively funded, so it's on kind of a 2-year cycle and supported that way. Next slide. So this is one that actually recently finished in December, although we always have hope that we'll be able to kind of restart it. But this is the Washington Oral Health Workforce Tracking Program. So throughout its course, really focused on providing relevant information about the oral health workforce to guide practice and policy. And this was the staff group that was on it. And the next slide, I think, kind of gives an example of some of the ways that we displayed the information about the health workforce that we were gathering. So this is looking at the distribution of dental hygienists in Washington State and also by kind of rural urban counties. And then a few other projects that we have done kind of within Washington State. You can go to the next slide here. Is one that we finished this past year looking at occupations that provide anesthesia care in Washington State. This was actually via a proviso from the legislature, originally meant for 5 years, but reduced to 1 just due to budgetary purposes. This was really looking at the distribution demographics of the workforce, scope of practice, so kind of comparing scope of practice across types of occupations. And for this, we did a deep dive literature review, but then also analyzed licensure data for certified registered nurse anesthetists and then physicians as well. We recently finished a project working with the Department of Health to compile a health workforce data catalog. So this was a composite of national data with state level measures or state specific data that's generated in Washington State. And we also finished a project with the Washington State Dental Association focused on examining an Indian Health Service role, the expanded function dental assistant role, or perio FDAS. And this was kind of their interest in looking at this in terms of thinking about it as a role for the broader state. And then last slide here, we also have a dashboard, and this dashboard reflects really, it's an index that we created reflecting state level policy support for the maternal and child health workforce. So this is national, but each state can look at their own score and get a sense of kind of why they scored the way they did, areas that are more assets, areas of opportunity to increase support for that workforce, et cetera. So those are just some examples of work we've done, and I'll pass it over to Janessa.
Next slide, please. So as I mentioned before, I'm with the Rural Health Research Center, and we've been funded for 38 years and do a combination of state and national policy work. And actually, a lot of our state work is in collaboration with the Center for Health Workforce Studies, and there's quite a bit of overlap in our Venn diagrams. And so a lot of the workforce work that we do, probably all of the workforce work that we do, is in collaboration with the Center for Health Workforce Studies. In specific, the topics that we really focus on, and I think my next slide will talk about the different types of rural health research centers around the country. But the things that we focus on are provider supply training and deployment, workforce training pathways, health services utilization, and then trying to provide evidence for helping support access in rural underserved communities. And this is a map of all of the currently and previously funded rural health research centers across the United States. We're the only one that's been continuously funded since 1988. And all of the centers really focus on conducting timely, policy relevant, bipartisan, or nonpartisan, I guess, policy research, specifically to help inform HRSA and the Federal Office of Rural Health Policy on making decisions around access and workforce services. So each center has specific areas of expertise, much like the Centers for Health Workforce Studies. And our focus is very specifically on the rural health workforce and rural health access, including training of providers and across all types of providers. And so I guess it's a collaborative cooperative agreement. And so we are not conducting research grants so much as we're doing white papers and really focusing on work that is going to be directly applicable to the interests of the federal office, which includes both state and federal projects, depending on what the interests are. And so I have a couple of examples on the side, and you'll probably get the slide. So I'm just going to breeze through these. If we could go to the next slide. This is a 2024 policy report that we put together that's very broad and very large, and it's looking at trends in health workforce supply specifically focused on the rural United States. And so in the figures, the figure on the right, the map, the cells that are colored, or the counties that are colored, are what we consider using whatever schema we use for this project, because there are a variety of rural urban schema, are all of the rural counties are the colored ones. And then so this is specifically focused on rural counties and looking at persistent and widening gaps over time, including access to data and what are the most optimal data sources to look at county level workforce supply. We can go to the next slide. And this project is looking at youth mental health access. This is a pet project of mine. I live in northeastern Washington state, and it's a big issue out here between sort of Idaho and the Canadian border. We have very few providers. And so I do a lot of work locally with our counties, but then this is also a project that we've been working on with the Federal Office of Rural Health Policy, looking at access to care, but also looking at prevalence and how they're related. So prevalence of mental health conditions among youth. So this is a project that we're wrapping up right now, and it includes 5 or 6 different projects, including looking at cross-state, interstate licensing agreements and reimbursement policies. We can go to the next slide. This is another project that we just recently wrapped up, looking at various specialists and looking at supply and distribution and access of these specialists specifically, because we know that's a major issue in rural healthcare. And this was a combination project using both quantitative data and qualitative data. So interviewing key informants about some barriers to access and also ways that we could improve access. And so looking at different ideas or recommendations that our experts have in the field. So if these are folks working in the field and what we can do to help improve services and access to care. Next slide. And this is just a summary slide showing these are our current projects that are funded by the federal office or other partners, looking at rural health workforce. And so, our portfolio really does span the continuum of workforce development, from medical student training and residency to different models of provider supply and distribution and reimbursement policy. So I've been working really heavily with Medicare data recently on reimbursement for marriage and family therapists and mental health counselors and how that's affecting our supply. And so, we're both looking at short-term and long-term workforce solutions, which lends itself really nicely to the work that we'll be doing here in Oregon around provider incentive programs. And so really applied work, really near and dear to our hearts. And I'm going to pass the torch to Paula to talk about timeline and engagement.
Great. So you can go to the next slide. This is detailed, and for all of you getting the slides, later can look at this if you want to and more. But we wanted to kind of give an overview of both our next steps, so kind of what it looks like for us as we're getting going on this work, and then also plans for engaging with you all to give feedback and et cetera throughout the process. So it's kind of separated into 3 phases here. And this first timeline is specific to the provider incentives evaluation. So this phase 1 really for the next few months, developing an evaluation plan and framework. And as we are doing that, ensuring we're meeting with you as well as the advisory committee and the policy board to get feedback throughout the process to ensure that everyone's on board with kind of the direction we're going, and then drafting this evaluation plan and framework, which we would submit at the end, kind of an initial plan at the end of March. And then phase two is really developing a draft of the report. And again, that would involve kind of ongoing data collection. We've received, some of the input and feedback from the last plan, so ensuring that we're incorporating that. And then gathering feedback from all of you in April at the education webinar there in preparation for kind of a final approval vote during your May meeting. And then officially submitting this kind of approved plan at the end of June, but kind of ongoing report work during that time as well. With the plan at the end of that phase for the draft report at the end of September. And then phase three is continuing to get feedback from yourselves as well as advisory committee and the policy board through different events that we have listed here with a final draft for circulation on December 20. So, and then final approval votes and report submission in January, and then plan for additional presentations as needed after that. So that's our plan for right now for the evaluation. And the next slide, the needs assessment is very similar. So I probably won't go through it in quite as much detail. I think the biggest thing to know is that that timeline's a little earlier, just so we could stagger getting feedback on the needs assessment and the evaluation report and plan at different times. So our plan for this is actually in February to meet with you all at the education webinar in February to get feedback to inform an outline for the needs assessment. And then in March to present a draft outline to all of you with, again, plan for kind of an approval vote for that in May. And then the outline for the needs assessment we would submit in May. But then ongoing work throughout the summer with the draft needs assessment due at the end of August. So, and then a similar process for feedback and final report submission for the next few months there. So I didn't want to take too much time going over that because we did want to leave time for questions for anyone or clarification. So I'll pause there.
Hi, you guys. Thanks. Having been very familiar with WWAMI because I was a rural program director and knew many of the program directors from WWAMI. So if you want to streamline your gathering of information about the historical roots, both for family medicine and behavioral health, I'm up to talk to you guys anytime. I can probably summarize the history of the state since 1990 to present, if you need that information or you find it to be valuable. So.
Great. Thank you. Yeah, appreciate that. We'll make note.
Okay. Yeah. A lot of stuff about HRSA and Title VII grants and starting new programs here. And yeah, at least as far as the doctor stuff goes.
Yeah. Amen.
A little bit about the nursing, PA, NP. Also have quite a few, AHEC, all that stuff.
Mm-hmm.
If I can remember it, I'm getting too old to remember anything about it. But
all of it's valuable.
Oh, so question, how do you see, I mean, I see you've got us meeting in February and March as a group. Are you going to be looking for other participation from members of the committee in terms of development of the report? Sort of more regular input, as it were. I can tell you in the previous report, we got very infrequent information throughout the development process, and the committee had a hard time really grasping ownership of the project in any way. So just kind of wondering how you see, or if you would like members of the committee to be involved just in being able to answer questions or being available for meetings or however that might work.
There has been discussion about having special sort of work groups or breakout groups that are have various areas of expertise. So, with the example of a focus on oral health, we'd bring folks together who have sort of that background and history and work it more intimately on that part, is specifically for the needs assessment with those folks rather than, kind of engaging with the broad swath of folks. And so we have 4 areas of focus for the needs assessment that we've been asked to focus on, and that's oral health, primary care, behavioral health, and looking at social determinants of health and social determinants of work, which is sort of a spinoff, I think, of the last report. And so developing somewhat informal work groups, because I think that if there's someone who's going out on leave, or, we don't want it just to end up being, but, being fairly fluid around knowing who to engage about specific topics, and then setting up regular meetings with folks who can help answer questions and then provide feedback as we move forward on those specific topic areas. And then obviously we'll engage at regular intervals with the whole group. And then I think that the door, Paula would agree, the door is always open. So, for me, it's very important that this is not a solo endeavor, or that it really is. Engagement is extremely important.
Good to hear. Yes, thank you. And it's certainly available.
Yeah, I think that sounds great because, Ian, you bring up a really good point about most consultations and surveys and things that, sometimes the group process is not the best, but.
Mm-hmm. All right, thank you. Okay, 4, so let's hear. All right, committee members, any further questions for the folks from the Center for Health Workforce Studies and the Rural Health folks? Any other questions? Great. Yeah, this is going to be a big part of our sort of required work for the next year. So we really appreciate the thought that's gone into this and the continuing chance to work with y'all. We had Dr. Frogner present to us last year, and the presentation was really well put together and really helped us quite a bit. So we appreciate that. Okay. Well, folks, our next meeting is going to be March 11th, 2026. We do have a February educational meeting that keep your eyes out on the emails. And guess I will hand this off to Kelly, as you're now the chair. Do you want to adjourn the meeting?
Sure. I could practice now. Thank you, everybody, for spending your time with us this morning, and it was delightful to see your faces. Thanks to the folks that presented about your upcoming report, and we will see you again soon. Have a wonderful Wednesday.
Excellent job, Kelly.
Thanks. Yes.
Thank you.
Bye, everyone.
Bye.
Thank you.